Okay. We're live. We're live. It's Bill, the knee pain guru. Today is, what do we got? Wednesday, July 14th, 2021. Today we're going to talk about lateral releases for knee pain. And I'm going to read you what the medical definition of a lateral release is, which is interesting. Lateral release surgery, also known as keyhole surgery, is a procedure performed to realign the kneecap, patella. Typically, the lateral release is performed as an arthroscopic procedure in an outpatient setting. The goal of the lateral release surgery is to relieve pain associated with a partially dislocated kneecap. This was on bonsecors.com. So, lateral release surgeries, and the motivation for this video was from an email that I got from Nicole on the YouTube channel. This was on bending after ACL surgery. It was a video I did a couple of days ago. And Nicole writes, I had a lateral release in April, and doctor said it's common for women to need it on both knees. Is it? Okay. I have two bad knees from sports. Injured first knee 4 years ago, second a year and a half ago. Don't want to have to go through this again. It sucked, but I want to get back to sports. Thank you for the information you share. And this is really important when we want to take back our own sovereignty, let's call it, as far as what's going on with our bodies. And many times we take what the doctor says as being, well, going with that. We're taking it at face value, and the doctor says it's common for women to have it. Is it common because that's what he just recommends to women? Or, like, it doesn't make sense. If the body is in pain from a very basic fundamental perspective, nerves in the knee are being squeezed, sending a signal to your brain that you have pain. Doesn't matter if it's in your kneecap. Doesn't matter if it's in the back of the knee like a Baker cyst. Doesn't matter if it's in the front of the knee like a dislocated knee or patella tendonitis, patella tendinosis. If it's in the joint like arthritis, bone on bone, whatever it is, there are nerves in the knee being squeezed, sending a signal to your brain that you have pain. Get the pressure off of those nerves, and the pain's going to begin to go away. And we're going to have a completely different conversation. It's important to understand no one goes to the doctor because they just feel good. Someone goes to the doctor. Everyone goes to the doctor because they're experiencing some sort of discomfort that they want something different in their body, be it in their knee or elsewhere. Well, if we could begin to understand what's going on in our bodies on a deeper level, and we can begin shifting those patterns that are causing the pain, what conversation are we really having? It's a different conversation. Now, dislocated kneecap is no fun. Dislocated kneecap is painful. However, dislocated kneecap doesn't indicate that anything is broken or torn in the knee, if that's the official diagnosis, and that there's a tension pattern that the body held on to as a result of the pain it experienced from the dislocated kneecap that needs to be, the neurology needs to be changed so the kneecap will go back into place. And that gets us back to normal. The kneecap has the opportunity to heal when it's in place. Structure governs function. Now we have the structure of the knee in a place where it's able to heal itself. When the kneecap's in place, now we can begin to set up the conditions in the knee, in the legs, in the hips, the lower back, in the body to support the healing of the knee. And if this is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. My point being is Nicole, who has already experienced a lateral release, and I actually had a girlfriend several years ago who had a lateral release as well, and she was dealing with all sorts of issues on the other side of that. The point of it is, many times, if we're just going to have surgery for the sake of relieving the pain, it doesn't necessarily work. And many people find themselves in the same position after having the surgery, and it made their situation worse. And now they're getting more fatigued, and they're tired, and they're frustrated, and they just want to be out of pain, and they want to do something so they can get back to sports, they get back to living their life the way it was before the knee injury, which totally understandable. However, if we don't take a step back, if we don't have enough information in the room, and we move forward with a procedure that can't be reversed, and we make the situation worse as a result of making a step forward without full information, it's not a real strong strategy in the bigger scheme of things. What I'm suggesting is that your body has the infinite capacity to heal itself. Make sure nothing is broken or torn first. Make sure you go to the doctor and you get an official diagnosis to determine what is going on. In this case, Nicole had this dislocated kneecap that was causing the pain. But think about a dislocated kneecap in a different way. Thinking the kneecap is out of place, and if we put the kneecap back into place, that the problem will be gone. And on a certain level of thinking, that is correct. However, what we aren't taking into consideration is, why is the body pulling the kneecap out to begin with? And if your body can pull the kneecap out, it can also pull the kneecap back in. Why not? These are tension patterns that are going on in the knee, the leg, in the entire body, that when we have an accident, an injury, a surgery, accident, injury, whatever it is, whatever we're experiencing something that we don't like in our physical body, what can we do to begin to change the neurology to comfort and let the nervous system reorganize around that? There's no reason why it couldn't happen. Actually, I see it happen daily. If this is making sense, give the video a thumbs up, like and subscribe to the channel. And here's some action steps you can take. First action step is you can head on over to the kneepainguru.com website and get on the newsletter list. Second action step you can take is schedule a time that we can figure out a strategy for your knee, whatever that might be. And the third thing you can do is sign up for my group coaching program, Knee Club. It doesn't matter what you have going on with your knee. We can begin teaching you how to get the pressure off of the nerves and getting relief today. Set up the conditions so your body can heal your knee. That looks like water, nutrition, breathing, mindset, stretching, mobility, pain pattern interrupts, and exercise. So it's very comprehensive in terms of what needs to happen in order to reestablish your personal sovereignty with your knees. Because we want to take the information you got from your doctor and bring that into the conversation to figure out what is the bigger strategy that needs to take place. Because it was the same situation I ran into. Doctor did the surgery on my left knee, did physical therapy on my left knee. But after the surgery and the physical therapy and the big DonJoy titanium knee brace, they were like, well, that's all we can do. And that's the reality. The docs can only take it so far. And we have to understand their limitations as professionals. And in order to get on the other side of that experience of whatever your knee is there to teach you, whatever you're there to learn. For me, it's been a 23-year learning lesson. What do you want your knee to feel like? What do you want your leg to feel like? So, if you got questions, type those in the comment section. I got a private coaching client here in 9 minutes. I just got the notification for that, so I'll have to scoot here shortly. But if you have questions, please ask them. Everything that I shared with you about the links to take action is down below this video in the description. You can check that out. Even if you're watching the replay of this video, type in your comments because I use them for future videos. But the point of it is you don't have to suffer unless you want to, unless you're getting something out of it. A lot of people do. A lot of people like playing the poor me role. Oh, my knee hurts. Oh, I've done everything. Oh, I don't know what to do. And they like feeling stuck and disempowered, which is fine. I'm not your guy, though. But the point of it is, when you do want to start taking control of this situation, I'm here. Been here for 13 years online. Okay, no questions coming in. And yeah, I think that's all she wrote for today. So, okay, well, thank you so much for being here. Appreciate your time, your attention. Share this video with your friends, your family, your loved ones, especially the ones that limp. They're easy to spot. And I'm going to scoot. This is Bill Paravano, the Knee Pain Guru, signing off for today. Have a wonderful day, and I will see you on the next one.